Féile is a community nursing service developed in recent years as part of my advanced practice role to support the growing number of people living with dementia, a number that is expected to nearly triple by the year 2050. Currently, over 64,000 people in Ireland are diagnosed with dementia, and 63% of them are living at home. At the heart of this service are the HSE values and my nursing principles of care, compassion and commitment, with the service ethos: forget me not, for I am still me. Every day is a journey, my journey, and a strong focus on what matters, which are the key drivers of our approach to care. Féile provides holistic, person-centred and rights-based care and support for patients and their families, helping them to live well at home. This includes addressing physical, cognitive, emotional, psychological and social needs through both individual and group-based support.
I have known Edel since she started her journey into older persons at Cherry Orchard, working in various roles. In 2017, when Edel asked me to mentor her as she pursued advanced nurse practitioner training, I was thrilled. Working with her has not only enhanced my own reputation, but has also taught me invaluable lessons. Edel embodies all the qualities that define an excellent nurse and more. She is kind and compassionate and empathetic, with remarkable emotional intelligence. Her gentle yet resolute demeanour fosters a holistic approach to patient care, which she consistently applies at Féile, always striving for better outcomes for the patients she supports.
Service pathways are designed to support patients from diagnosis through ongoing care, ensuring seamless access to specialised public health services. Achieving this requires a well-coordinated network that brings together various healthcare professionals and stakeholders across public, private, voluntary and community sectors. This coordinated approach facilitates ease of access, allowing patients to navigate between services as their needs evolve over time.
Féile is a new way of working that supports both the patient and their families to live well at home. It's incredibly rewarding to witness firsthand the improvements in a person's well-being and to support them along this life-changing journey. The motivation comes from being part of a new service that continues to expand and innovate, allowing us to make an even greater difference in the lives of those we work with.
Referrals to Féile come from various sources, including community nursing, primary care, acute hospitals, memory clinics, GPs and more. The 4 M's framework, what matters, medication, mentation and mobility, is embedded in a comprehensive assessment to identify the patient need. Based on this assessment, care is planned and tailored to support the patient to live well at home as an active member of their community. The service offers different care pathways, with each patient directed to the most appropriate one based on their unique needs and personal care goals. This approach ensures that patients receive the right level of support to maintain their well-being and independence. As we know, memory difficulties are a common symptom of dementia. At diagnosis, this pathway offers therapeutic and emotional support to help patients and their families process this diagnosis and adapt as needs change. Interventions include the LiveDem Group Programme, a memory lounge that focuses on brain health, cognitive stimulation therapy, a gait balance programme, and most importantly, peer engagement. Education and advanced planning are also introduced to ensure ongoing support and readiness for future needs.
When you first hear a dementia diagnosis, the fear, anxiety and isolation can be overwhelming. You're given pamphlets and phone numbers, left to navigate it alone. But meeting Edel changed everything.
Connecting with Féile, I felt more supported and less overwhelmed. I really enjoy going to the memory lounge because it allows me to meet with others who face similar challenges. Being part of this community helps reduce anxiety and fear. I've noticed that as I improve my memory skills, my confidence also gets a boost. It's encouraging to see that I'm not alone in this journey, and as I've said many, many times before, life is not over with this diagnosis of dementia. It's just different.
The non-cognitive symptoms of dementia clinic addresses the complexity of non-cognitive symptoms and their impact on daily functioning. Patients often experience symptoms such as fear, anxiety, and low mood, which can vary across people and stages of their journey. To support both patients and families, assessment and management plans are initiated. This includes non-pharmacological interventions to treat symptoms without medication. A key aspect of care is identifying what matters to the patient and developing a personalised wellbeing plan. Education and support services are also available to help families navigate these changes.
Féileacán Bán has been a lifeline for both Jimmy and me. The emotional support we receive is incredible. It helps us feel understood and supported on our journey. Between clinic appointments for both the physical and the emotional aspects of brain health and programmes that also support me, each part offers us a sense of community and reassurance. The connections we've built with Féileacán Bán has made a huge difference in our lives. I honestly don't know where we would be without the support from Adele. It gives us hope and strength every day.
Part of this service has really helped me on my memory. I don't feel as bad as I used to. I like doing the brain health activities. It's nice to see familiar faces.
Should a patient become unwell at home, choose not to attend the clinic, or find themselves in crisis, the community pathway is designed to provide the necessary support. Féileacán Bán offers a range of services, including home visits, crisis intervention and video-enabled care. Additionally, community programmes such as the Brain Gym Home Programme and the new Community Cafe provide valuable resources and opportunities for connection. These initiatives create a supportive environment where patients feel understood and cared for.
The support we've received from Féileacán Bán has been invaluable. The team at Féileacán Bán have been there for us every step of the way, offering guidance, reassurance and a sense of hope during difficult times. The service has made a real difference in our ability to manage the complexities of dementia with more confidence and peace of mind.
The Brain Gym has been an excellent resource in supporting my memory and my emotional well-being. The tailored exercises are simple yet effective in promoting brain activity, and I found them to be quite enjoyable. The activities are easy to follow and have created a sense of accomplishment and stimulation, which has made a noticeable difference in my daily life. Overall, it is a positive and encouraging part of my weekly routine.
When working with patients, it became evident that family care partners also needed support as they navigated this journey alongside their loved ones. In response, Féileacán Bán established 3 carer support network groups, each tailored to different stages of the caregiving experience. These groups offer caregivers a safe space to share experiences, engage in peer support, and receive professional advice. The network helps reduce caregiver stress, empowering them to maintain their well-being, and in turn, this benefits the patients.
The peer support we get here is truly incredible. We get such valuable insights from one another, and we get great supportive advice from Adele, and we also get lots of practical tips. We get practical tips that help us on our journey with our loved ones.
I've struggled in my situation with the sense of loss and loneliness. But meeting up with this amazing group of people and having Adele there with her thoughtful advice and suggestions on how to cope, that gives a sense of togetherness and is very comforting. And that connection eases the sense of loneliness that I experience, and it keeps me going.
Féileacán Bán has been a constant support to me and my sister from the time she was diagnosed and right through on her journey to long-term care. Adele has been an inspiration to us. Her guidance has helped us with just practical support and advice, and also with our mental, how we sort of cope mentally with what's going on. Even if I had a problem now, I would still come to Edel because her expertise in so many different areas is just second to none.
Féileacáin Bán supports 250 patients each year, ensuring timely care, hospital avoidance and early supportive discharge. The service focuses on improving quality of life and empowering patients and families to live well at home. While the team and networks continue to grow across the health, care and community landscapes, the service remains centred on the patient and their family, offering needs-driven support that fosters independence and well-being. Through partnerships across disciplines, Féileacáin Bán also works to reduce stigma, raise awareness and build more inclusive communities. As a practitioner, flexibility is key in adapting to the dynamic needs of patients and families. Féileacáin Bán is proud of its lasting impact and its contribution to greater community understanding and inclusivity for all people living with dementia.